Welcome back to Diabetic Foot Files. I should start doing this Diabetic Foot Files at midnight. So, beneath the skin, beneath the fat, and beneath what we understand lies a network that connects, protects, and sometimes destroys. So today we're gonna quickly talk about the fascia, which is it's not an invisible structure, okay? But it is a structure that either guides healing or carries infection. Remember, they like the path of least resistance and they like to go along the fascia, okay? So what is the fascia? The fascia is a continuous connective tissue network that surrounds the muscle, the bones, the nerves, and the blood vessels. So think of it like a biological wrapping system, a tension distributing web, and a communication network. So there are different types of fascia. There's the superficial fascia, which is located just underneath the skin, contains the fat, the vessels, and the nerves, acts like a cushion. Then there's the deep fascia, which is dense, fibrous, surrounds the muscles and the compartments, critical in compartmental infections. And then we have our visceral fascia, which surrounds the organs. This is less relevant when it comes to our feet, right? But the same principles apply, okay? So the fascia is continuous. So infection doesn't stay local, it travels along the fascia a lot of times. So when it comes to the molecular aspect of it, so the structure of the fascia is collagen. So collagen type 1 and type 3, and then elastin, and then the ground substance is hyaluronic acid. And the ground substance role is allows sliding between the tissues and maintains hydration. In diabetes, remember, we have the glycation of the collagen, which will result in stiffness. So that reduces the elasticity and impairs the diffusion. So the fascia in result, the fascia becomes less flexible, more prone to injury, and more susceptible to infection spreading. And in an infection, the cytokines increase the permeability, the enzymes break down the collagen, and bacteria releases its toxins. And like I said, the fascia becomes a pathway of least resistance. So when it comes to the fascial anatomy of the foot, this is where sometimes things can get dangerous, and I'm gonna make this super quick, I apologize. So the plantar fascia, that's one that we all know about, that supports the arch, connects the heel to the toes. Then our fascial compartments, there's the medial compartment, central compartment, lateral compartment, and the interosseous compartments. And why does all of this matter? Each compartment can trap infection, build pressure, and actually even cut off blood supply. And a small infection in one space can spread across the entire foot via the fascial planes. And the fascia does not stop infection; it actually guides it. It's like a highway for infection when an infection is there. So the mechanism of the spread is the infection enters either through an ulcer or trauma, right? The bacteria reaches to the fascia, the enzymes break down the tissue, and the infection tracks along the fascial planes. And the result would be a rapidly spreading infection with minimal early symptoms and massive internal damage. So things like necrotizing fasciitis, you've heard me say that multiple times. What happens? The bacteria destroys the fascia, the blood supply collapses, and the tissue dies rapidly. And common organisms are usually group A streptococcus or their polymicrobial infections. And red flags are pain out of proportion, skin discoloration, crepitus, and systemic toxicity. So the fascia allows infections to move faster than the skin can show. So when it comes to early anatomy, which I should have discussed earlier, there's Andreas Vesalius, and he was one of the first people to do detailed human dissections. And then there's Jean-Claude Gumberto. I'm so sorry for pronouncing your name wrong. To show that the fascia as a dynamic living network. And, his contribution showed that there's microvascular imaging and the fascia is seen as fluid plus fiber system. So what is the surgical importance of the fascia? Certain surgeons, we don't just cut the tissue. They say they teach you to follow the fascia, right? So that's why the fascia matters in surgery. So it matters a lot when it comes to incisional planning. So you follow the fascial planes, it helps reduce damage. And then drainage of infection, you must open the right compartments, right? And use a hemostat, follow any tunneling, sinuses, anything like that, you know, and break the fascial barriers. And then debridement, we remove the necrotic fascia or tissue and prevent the spread. But if you miss the fascia, you miss the infection, right? So, quick case study: small ulcer, deep fascia, minimal skin changes, extensive internal damage. With necrotizing infections, there's a rapid deterioration and it's a medical emergency. Remember, there are 5 medical emergencies when it comes to podiatry, I believe. And neck fascia is one of them. Simple as that. And like we said, the chronic stiffness due to the advanced glycation end products causes increased plantar pressure and ulcer formation. So how do we prevent this? I'm so sorry. I have the cold, so I'm trying my best just to get through this real quick. Glycemic control prevents collagen damage, pressure offloading, early infection treatment detection, and mobility and stretching. That's why I like a night splint. So the fascia is not just a structure, it's a strategy, okay? It's a network pretty much, and it protects the foot or it can betray it, okay? So in diabetes, when the fascia becomes compromised, infection doesn't just spread, it actually travels. So we have to learn to respect the layers because what lies underneath, decides what survives and what doesn't. And this was, I believe, one of the quickest episodes of Diabetic Profiles that I've made. And this is Dr. G. I hope everybody's having a great weekend and take care of your feet because they take care of you.